Good evening. I am coming to you today to share with you a journal article review. The title of the journal that I will be reviewing is Type 2 Diabetes Remission and Lifestyle Medicine, a position statement from the American College of Lifestyle Medicine. The name of the journal for this article is American Journal of Lifestyle Medicine. Also, the main author is Dr. John Kelly. The type of article this is really is considered a position statement by the American College of Lifestyle Medicine. As much as this article does have literature review included, however, it really does not follow completely the style of meta analysis or systematic review. Funding sources: the authors disclosed the receipt for the financial support. The authors declared, excuse me, funding source was the authors disclosed the receipt of the following support for the research, authorship, and publication specifically of this article. The author's conflict of interest: there was no potential conflict of interest noted. So, the objective of this article was to evaluate the lifestyle changes in diabetes treatment, which is essential to advance solutions that treat the cause of the disease to really contain the spiraling increase of cost of diabetes management. The design is there was a literature review that was done, and it was done from PubMed with no date restrictions that identified papers with research terms that included diabetes and either remission or reversal in the title through April the 9th. Also, the main outcome noted in this article was that supports that type 2 diabetes remission in diabetic patients, definitely lifestyle was a primary form of treatment. Physical activity appeared to have a minor role compared to diet. While most of the studies did show an increase in physical activity, they achieved remission without always having an increase in exercise protocol. Nevertheless, physical activity has been shown to improve the insulin resistance. The primary results was that remission should be the clinical goal in type 2 diabetes. The treatment should definitely be considered around properly dosed intensive lifestyle interventions as a component for the care of type 2 diabetic patients. The limitations within this article includes that the lifestyle intervention studies with type 2 diabetes remission are few in number with a wide variety of design, as well as being generally limited in short term outcomes. Also, a majority of the therapeutic studies examined would not meet the definition of remission as noted. Those through there is a lack of consensus on duration needed to assess the remission among clinicians and researchers. Most of the studies of remission have examined type 2 diabetes for a short duration, and success rates are higher the earlier treatment is initiated after diagnosis. Why is this study or article, I should say, important? As the incidence and prevalence of type 2 diabetes continues to rise, The current best evidence from multiple interventions studies supports that remission achieved is done with intensive lifestyle modifications and should become the preferred treatment and standard of care. To achieve remission, appropriate therapeutic dosing of lifestyle modification is necessary. Also, type 2 diabetes continued to rise. So this position statement allowed for multiple intervention studies to be reviewed and to also share how definitely lifestyle changes can help with the achievement of remission with therapeutic dosing of those lifestyle modifications. Thank you.